So, if one of my patients were to refuse a treatment because of their religious beliefs, I think, you know, before the conversation even happens, it's really important to keep in mind the concept of patient autonomy. Their needs do come first ultimately. Um, but before, I just kind of just say, that's fine. We'll put you in comfort care or depending on the treatment, we'll withhold whatever we deem medically necessary. Um, but before doing that, I think it's really important to have a open conversation, kind of uh, uncover what they're thinking, what their specific beliefs are, what kind of concerns they have about the treatment, and answer any questions they have, and kind of approach it from a objective standpoint. If somebody has something like meningitis, and they need antibiotics, and it's a easily life-threatening disease with a relatively low-risk treatment, I would be towards the side of leaning towards treatment. If it's somebody with terminal cancer, and they don't want to suffer through chemoradiation, um, I wouldn't quite press quite as hard. Um, but there's a couple of things depending on the situation. But I think most importantly, it's respecting the patient's beliefs first and foremost. Um, kind of, but also having an open dialogue, um, and kind of uncover what their thinking is, what their concerns are, and provide them with information that will help them, make the best choice for them. Um, because doctors, we're definitely moving away from the paternalistic relationship that we had in the past and leaning more towards empowering the patient and letting them make their own decisions. Um, so we really are here to guide patients and give them good information and give them our opinions, but also let them ultimately decide what to do.